Dr. Pittaway, we hear lots about, when we talked about children, and we hear lots about sealants. What do they do, and are they really as preventive for cavities, as people say? Is it a good thing for children to have it?
Well, helmet sealants are a wonderful service. If performed correctly, I always study the tooth very closely for decay before I seal them. It used to be believed if you sealed a little decay in the tooth, it would stop it. It certainly does slow it down, but I have found many cavities under sealants. And so now I check the grooves, I clean them out, and it's a very simple, painless, quick procedure we can do on any child that protects their permanent molars from decay on the chewing surface where those deep grooves happen. It's very easy to do, it's quick, and it's really very inexpensive as well. It's great insurance against future decay, and even the materials now have a protective effect on the tooth. So I recommend sealants for all my children patients who have their first molars and their 12-year molars that come in when they're about 12, of course.
How long do they last? Once they're on it, a year, 2, 5, what's the deal?
Well, that's a good question, because I think a lot of it has to do with the children's mouth, what kind of environment it is. I see sometimes they don't last more than a year or two, but then again, I also see them when they've been in someone's mouth for 15 years. And so it has to do with how well they were placed, what material was used, how much humidity was in the mouth, the condition of the enamel, and what they're eating, what they're chewing, how many caramels they're having. So generally speaking, sealants last, it's not important how long they last. The truth is, the benefit from the sealant comes when you do the sealant and you're protecting that tooth through the first 3 to 5 years of it being in the mouth. After that, the sealant's really not as important. If it's lost and there's no decay, I frequently don't have to worry about it very much, and we will reseal them if they're still at risk for decay or we feel that needs to be done. But if, let's say, you were a 12-year-old and your sealants are gone when you're 18, don't worry about it. You're probably fine.
Got it. Wonderful. So basically what you're saying, adults really don't need sealants.
No. The teeth are much more vulnerable when they have just come into the mouth in younger children, and that's when they have the most benefit to prevent those cavities that I see everybody has filled. My patients, I see so many back teeth filled that may have been prevented by sealants, and every time you can prevent a hole in a tooth, that's a good thing.
I would say so. As you said, in dentistry, it is the branch of medicine which is the most preventable. You're right, it's a cliche, everybody says it, but it just happens to be true. Be it your liver, your heart, your brain, your blood. Yes, there's prevention out there. We know that people live longer due to good medicine these days, but dentistry, at whatever bad stage it reached, it can be stopped for the next bad stage. It can be prevented. And whatever bad stage is reached, it literally can be fixed and made going back again. That's just a fact. And so it's really amazing that so many of us have dental problem when yet it can be prevented. It's a shame, isn't it?
Well, it is a shame, Helmut. But, it doesn't mean that someone is a bad person because they didn't come to the dentist for prevention. The problem with dental disease in general, with gum disease and tooth decay, is by the time you feel symptoms from the problem, enough to alert you to come in, it's frequently a pretty big problem. In gum disease, by the time you feel the gum disease, it's almost time to pull the teeth. With cavities, by the time you start to get a toothache, well, it's almost time for a root canal or an extraction. I had to do that today, as a matter of fact. I had a tooth that patient didn't feel any pain until recently, but it was already too late, and I pulled it.
Well, that's why I guess that coming regular is so important. Well, this was about sealants, and I guess you gave us all the answers to it. Thanks a lot, Dr. Pittaway.